Hello everyone, I am Dr. Karthik from AMSA Medical Center, Providence. The topic for discussion today is blood pressure. Have you ever wondered what blood pressure exactly means? When you ever visit a hospital or to a clinic to see a doctor, the first thing they do is to check your vitals, which includes blood pressure as the major criteria. Blood pressure medically means the pressure with which the blood flows through a blood vessel. Blood pressure usually contains two components. For example, if the blood pressure is 120/80, the two numbers 120 and 80. The 120 will be called the systolic blood pressure and the 80 will be called the diastolic blood pressure. Let's imagine the heart as a motor pump. To explain in simple terms, when the motor pumps, the pump is the contraction. So when the contraction occurs, the blood is pumped all through the organs, and this is called the systolic blood pressure. And after the pumping, it has to relax. So the relaxation is the diastolic blood pressure. So the systolic will be the 120, the diastolic will be the 80. So normal blood pressure is 120/80 millimeters of mercury. When the blood pressure is 135/88, it is called pre-hypertension. Anything above 140/90 is termed as hypertension. There are three stages of hypertension. We do not need to discuss about that in detail. So a high blood pressure, which is simply called hypertension, or a low blood pressure is always fatal. So what causes hypertension? One will be the lack of sleep, stress, too much of tension, and not able to sleep in a proper way. Like for example, if you're not having an adequate sleep, it will cause as a risk factor for hypertension. When you have too much of weight gain, like obesity, overweight, it will also add as a risk factor. If you consume a lot of salt-rich diet, for example the junk foods, these will also add as a risk factor. The fourth, probably alcohol, consuming alcohol, smoking. The fifth will be like too much of inactive status, like not doing any proper exercises, too much of consumption of calories, but it has not been worked out. So it will all add to the risk factors. And the hereditary as such, like if your father, mother carries hypertensive episodes, then it will also pass on to you. So how to keep yourself healthy if you are diagnosed as hypertensive? When you are diagnosed with hypertension, always monitor your blood pressure. There are various monitors, portable monitors available, or visit the nearby clinic. Check your blood pressure whenever you are free. Like that, if you keep checking your blood pressure, it will be monitored, documented, and you will also have a clear-cut idea of what the blood pressure is. So when your blood pressure is high, it will usually damage the organs like eyes, brain, heart, kidneys. So how to control the BP? Blood pressure can be controlled if you are tension free. Keep away the worries. Sleep well. Remove the excess calories by working out. Working out doesn't exactly mean that you have to hit the gym and develop the 6-pack, 8-pack. No, just have a healthy walking 45 minutes to 1 hour. Then avoid excess salt in the diet. Replace it with a lot of vegetables, fruits. Then if you're diagnosed with hypertension and if you're prescribed some medicines, compliance with the medicines is the important one. So take the medicine at the particular time the doctor has told you, and don't skip the medicines. Try quitting smoking and reduce the alcohol consumption, and do gentle exercises as I already told you. So as you are diagnosed with blood pressure, even if you're in the 20s, 30s or late age, just get yourself screened with blood tests that include ECG, your heart assessment regularly, then a blood test comprising of the tests that include the renal function test, which importantly includes the kidneys, and then do a urine test to see if there is any albumin leakage. Thank you.